section up there for the provider code. We would like for you to enter that code at the top of that form. As we go down, we see we have patient information. In that section, we need the date of service, which the date of service should be the date that the patient had a BCN visit. With WISEWOMAN and BCN, they go together. When you do a BCN visit and the patient decides that they want to do a WISEWOMAN visit, that screening should be done on the same day. So those dates should be the same. So we ask for the patient name and date of birth. We also ask for the education and language. Also, going down to the patient health assessment, we have 17 questions, and those questions are questions that are required by CDC. So that's the reason those questions are on that form. Going back to, Tiffany, let's go back to the health assessment. For questions 1 through 3, there seems to be confusion or misunderstanding on how to fill those questions out. If you read, let's take question 2, for example. Question 2 asks, do you have hypertension? If your answer is no, you would check no and skip to the next question. But if your answer is yes, you would check yes, that patient would check yes, go to question 2A, answer that question. If it is yes, then they would go to 2B. If the answer is yes for those questions, the patient must answer question 2D and 2E and 2F. And once again, going back to these are requirements from the CDC, so that's why we need this information. And like I say, if the patient answer is no, then it's skipped to question 3. And on page 2 of the health assessment, next page, we have question 3 through 17. For some reason, there seems to be confusion when we get to questions 5 and 6. Sometimes the patient do not answer those questions directly. They usually put sometimes, all day, not sure. We just need a cup amount, 1 cup, 2 cup, half a cup. So if those could be explained to the patient that we need, the cup amount instead of a written answer, that would help us out a lot. And also question 11, 12. Patient seems to get, I don't know, I guess confused when answering these 2 questions also. We need the number of minutes when answering these questions. They usually put all day, sometimes, not sure. One patient even wrote, I'm a waitress, I walk all day. So we kind of need like the minutes, 60 minutes, 30 minutes. Some patient do 600 minutes, 800, whatever that patient does in that week, just take a guess it, an estimate of what they're doing. If they don't know directly, just guess. And just put an answer there. We definitely need minutes there and not just words. Also, when we get to 14, no, not 14, we get to 15, 16, and 17, patients usually get confused with those answers. They usually write in a number of days. They might put 0. Then they'll turn around and check, I don't know. We only need one answer for those. You can write, if they don't know, just tell them, put, I don't know. So, it's just things like that that I notice when I'm dealing with the WISEWOMAN screening forms, that I notice that there is confusion as far as, what needs to be done. And like I say, the questions are there because they are a requirement of CDC, so we need the answers to these questions. And, it would help out if the staff member could assist these patients with filling out these forms, being that they may get confused or they don't understand. Staff members can assist patients with filling out these forms. Next form that we have with the WISEWOMAN as part of the billing is the clinical and billing form. On this form, we ask that you please put your provider label at the top. We ask for that label because when it comes down to billing, we need to know the provider who is billing for this patient. We don't want to confuse the payment with another provider, so please if you have those labels, put those labels at the top. You can also write in your authorization code. This helps us identify the patient, helps us identify the provider also. We ask for, back to the date of service, same thing. Whatever that BCN visit is, please do the WISEWOMAN visit on that same day and write that date in. Sometimes I receive forms that have different dates. There's a different date on the patient health assessment form and a different date on the clinical and billing forms. This creates a kind of problem for us, so please take note of the date that you're actually writing on these forms and try to be consistent and use the correct date. We have the visit information. During this form, you check the code for the visit, the annual visit. Then we have like the risk reduction counseling part. And with that, we have like the priority goals. When you're talking to your patient and explaining, giving them the options of what they can do, we ask that, they check what applies to them in the priority goal. If this is a goal that they're working on, please check yes. If not, then they can check no. And we need a stage of change, check only one answer for that. And we also have like the referrals. The clinical person knows what to do in that area. If a patient was referred to any of the programs, you can fill out that part also. And we have like the W9213. On this part, there is confusion because when we do a revisit, that code is for a revisit, and that revisit is for if a patient have an abnormal alert during their blood pressure, or say like for the glucose or A1C, if it's abnormal and that provider needs to bring that patient back in. That is a code that you would check on a separate form, not with everything else that's completed on the form. This needs to be on a separate form with just that W912 check on that form. We need the patient information, but you would only check the W9213 and send that form in, that clinical and billing form, into us. We don't need all the lab. We don't need the priority goals when you're doing a revisit. We just need, just a revisit. Going down to the clinical measurements, that part, we have the height, weight, waist circumference, and hip circumference. If a patient refuses to give those measurements, we do have a spot on there where you can check, say that patient refused. But, as much as possible, we would like you to try and get those measurements. If not, you can check patient refused. Same thing with the blood pressure. We have two blood pressure spaces. We have a first and a second. And we also say if patient refuses. You have that option that if they refuse, you can check that. Going down to where the cholesterol, the glucose, and where we do the lipid panel, that lab report. This is very important for us. This is the part where we need your lab report attached to these forms to send in order to get payment. If there is no lab report, there is no payment. So when we do these lipid panels, we need a fasting status because there is two payment type as far as with that also. If the patient is not fasting and they do a full lipid panel, you will not be reimbursed for that. This is what is on our fee schedule. So we need to know whether or not the patient is fasting or not. If a patient goes in and just do the total cholesterol, the HDL, or the glucose or A1C, it does not matter with the status whether they're fasting or not, that will be paid. But as far as the full lipid panel, we definitely need to know if that patient was fasting or not. And there's also a space in that area where if a patient refused to do the blood work, you can check that box that patient refused. But I'm just reminding you that if that patient refuses to do blood work, the Wise Woman visit is not payable. So we encourage you as much as possible to get those patients in there, encourage them to have their lab work done, and get those to us. The alert value that's on this form, that is for the abnormal um, blood work. If something comes up abnormal, like the blood pressure or the for the diabetes thing, you just fill that out. You know, you can just fill that out and document that, you know, there was an alert. And with that, that's where the revisit counseling comes in. That's where when you see that W9213 at the top, that's where if you have to bring that patient in because of that abnormal reading, you can rebill for a revisit with that W9213 code. So I think I've covered pretty much everything that you know, with the screening forms and what we needed. And also, once you have done all of that, remember to please attach that lab report and send it into us. That is very important. Okay, take the next slide.
Okay, before we proceed, if you are on a cell phone listening into the presentation, that may be the cause of the feedback. So if you could press *6 to mute yourself, or if you are on a speakerphone, a landline phone, please pick up the receiver because that may cause feedback as well.
Okay, so next slide, talking about tips for success. Include instruction sheet with health assessment and clinical and billing forms. I realize that some provider may allow the patient to fill out the health assessment form by themselves. If this is the case, include that instruction sheet that we have that goes along with it. We have step-by-step instructions telling the patient how to fill out these forms. If there is a new staff member, they may want to read over these instructions as far as how to fill out these forms, as well as, you know, the health assessment, as well as the clinical and billing form. So, you know, include those instruction sheets, even if it's just for the first time. Let them read and see what we're asking them to do. I know that you can give verbal instructions. Someone may hear it, but may forget it as they're going through. So instruction helps to understand things better. Staff members, our second thing is staff members should assist the patient with filling out health assessment forms. Realizing that these forms are your way of getting money. It is your way of receiving your money and being paid. So staff members can assist the patient to make sure these forms are filled out completely, make sure they have the right information on them, and make sure that, you know, everything that we are requesting are on these forms, because like I say, these forms are what generates your payment. If it's incorrect, your payment may not come or it may be held up. So just take a few minutes and go over these forms before sending them in to us to make sure you have all the information that is needed, that we are asking for in order to receive your payment. With the clinical and billing forms, like I say, nurse or assistant should complete the form. Make sure all of the information is there that we need. Make sure that, you know, everything is in check. And please attach that lab report. I keep stressing lab reports because we get forms in that do not have the lab reports, and like I say, you would not be paid without the lab reports. So that is why I am stressing send in the lab reports. If any staff member have any question about filling out these forms, they can contact me directly, 803 898-1494, and I would be glad to help you in any way I can, answer any questions or anything that you may have that needs to be answered. Next, next slide. Common mistakes and how to avoid them. Using outdated forms. All new versions of WISEWOMAN forms are embedded for providers who have access to Medit. You can go into Medit and pull these forms up. If you do not have access, you can contact Trinessa Jones, and she will be glad to help you out. The second thing is date of service from different date of service from BCN screening. Complete both screenings on the same day. This will avoid you not being paid because, like I said, Best Chance and WISEWOMAN work hand in hand. Those two dates have to be the same in order to get paid for that WISEWOMAN visit. You know, they have to be the same date on the screening forms. Not making sure forms are completed or having the response the question is asking. Like I explained earlier, sometimes the forms come in, they're not completed, and we have to send it back out, or we have to call and get the information that is needed. And, you know, this is holding up your payment because the information is not on there and it's not correct. You cannot get paid until we have the correct information. So please, like I said, take a few minutes, go over these forms, make sure the information is on these forms before sending them in to us. Taking second blood pressure, you know, we just ask that you take, if you can, take first and second blood pressure. Unchecked fasting and missing labs, like I said earlier, we do need to know if a patient is fasting or not. So we have received forms in which that status have not been checked. It's just been left blank. So, you know, we don't know. I don't know what to do because I'm the one that handles it. A lot of times, you know, I can't put in what you don't have on there. So please try and make sure that when you send in your WISEWOMAN forms, that this is an area that has the fasting status check. Because like I mentioned earlier, according to the fee schedule, there is, you can get paid for having what is needed. And if you do something that is not needed, you may not get paid. So please check that and send that in to us. Not submitting completed forms to DHEC within 30 days. Like I say, this depends. We need these forms in within the 30 days because, like I say, the earlier you get them in, the quicker we can get your payment out. So if you hold these forms, like now being that we're coming down to the end of our physical year, it's going to be a rush. You may send forms in that is incomplete, that do not have the information that we need in order to pay these things, to pay these bills. And I'm going to let you know now that if you send forms in that is incomplete or that are missing the required information at this late in the game, your forms may be sent back to you, or you may be denied payment because we're at our closeout time during this year, and it has been asked of you to get these in as soon as possible. And knowing that June 19th is our cutoff date for this year, so, you know, we're just stressing, if you have forms, send them in now. You have 1 week before June 19th. So if you are holding on to forms, send them in now. You can send them through the mail or you can fax them in. But please be reminded, do not send incomplete forms in without the required information for payment. Because if you do, you know, there's a chance, there's a possibility that, you know, these forms will be coming back to you in the mail, or like I say, you will be denied payment. So at this time, I am wrapping up what I have to say, and and I just want to say thank you for all of the BCN and WISEWOMAN provider who have helped us over the years. I would also like to, you know, in advance thank the one that may be thinking of becoming a WISEWOMAN provider. And, you know, I'm just glad of what I do as far as my job and helping people, knowing that what I do make a difference in the lives of someone else really makes my day. And I am glad to be in this webinar for today. And thank you, Tiffany.
Thank you, Ms. Genevieve. So the message is crystal clear. Make sure your forms are completed thoroughly. If at all possible, make sure that the BCN and the Wise Woman program services are offered on the same day. So practically speaking, if you have an uninsured woman that qualifies for both programs, ideally you want to have an appointment block and prepare that woman for the day in terms of her needing to fast. It'd be very similar to an annual physical for most of us that have private insurance that we're supposed to fast. So really from a practical workflow perspective is to really prepare that woman to make sure that this whole process can be completed effectively. Do not hold forms is another key message. Don't hold forms, submit them within 30 days from date of service, making sure that there's lab reports attached. And again, Ms. Genevieve is available for questions. And again, you have the opportunity to listen to this webinar again, but in real time, especially if those of you that are already providers have questions and need to meet that June 19th deadline, please give her a call. So really, at the end of the day, we need to answer the question for those of you that are thinking about becoming Wise Woman providers is the WIIFM question, and that is an acronym for what's in it for me. First of all, for many rural providers, they often have to write off services provided to self-pay patients because they simply do not have money to pay. And when we're talking about uninsured women between the ages of 40 and 64 years of age, most of the time they will qualify for these services. And so you have the opportunity to be reimbursed for providing a breast and cervical exam, that annual pap smear, that comprehensive breast exam, but also you're already going to take these labs anyway for a typical physical, and this is a way for you to be paid for such. For Wise Woman, beyond the initial screening, they are entitled to access to free diabetes prevention education, lifestyle coaching, and also taking off pounds sensibly program. So there's a weight management component. And so for those of us that are privately insured, you know that we have to pay separately for these services. Just picking up from the last webinar, many of us know that in rural communities, when you have a woman in front of you, you want to provide as much service as possible while she is there. So there's also opportunities to not only become a health coach through Wise Woman, but you can also co-locate a Taking Off Pounds Sensibly program at your location so the woman doesn't have to travel to a separate location. And also your health coach could be certified as a diabetes prevention educator. And DHEC subsidizes that, pays for it outright. So there's quite a few opportunities for providers to provide comprehensive services, and which brings me to my next point. Many of the services that are provided through the BCN and Wise Women programs also align with quality improvement measures for the Patient-Centered Medical Home program, your HEDIS measures, as well as the Physician Quality Reporting System. So you will receive credit for having these services already provided, and most importantly, documenting them in your system. So really having your EHR support the work that you're doing in person and being able to receive credit for that. And guess what? When you're meeting those quality improvement benchmarks, you can negotiate for an increased payment from Medicaid, MCOs, and other payers. And so there's also other incentives involved with providing these services beyond just being reimbursed from DHEC. So that's another great point, quote unquote, selling point to share with you. Also, as serving as the point of entry for breast and cervical cancer, as well as cardiovascular screenings through these programs, you have the opportunity to keep that patient in your medical home, to stabilize their health status and keep them coming back and keep them healthy, and ultimately avoid unneeded illness or even death. So here's just an example of an scenario, as Genevieve mentioned, where Best Chance Network services and Wise Woman are offered in the same day. And so you have the opportunity to be reimbursed about $444, give or take, depending on the situation of the patient. And also, you're also reimbursed for repeat visits for both programs. So this could really serve as an additional stream of revenue for your practice and possibly subsidize staff or even be able to hire a staff person to deal with these programs alone. Here are just some concrete examples of how the services that are provided through BCN align with the patient-centered medical home accreditation process, but also meaningful use, demonstrating meaningful use in your electronic health record system. You receive credit for team-based care, population health management, as well as meeting those quality improvement measures. For those of you that are preparing for the merit incentive payment system and lining yourself up for that, these services also give you a payment adjustment for providing those services. So these, again, are practical examples of such. So the now what? What is the call to action here? So here's what we've learned across these webinars and interviewing Best Chance Network and Wise Woman providers across the state. We'd like for you to offer both programs. In this particular case, the Wise Woman program. One key thing that every practice should have is to designate a practice champion. Now, that does not necessarily have to be the doctor or the nurse practitioner. Usually, it may be the medical assistant. It may be the nurse. It may be even a front desk person that has billing functions. Every site is different in terms of who their practice champion is, but they do have one. So this person is really the leader who internally coaches everyone and gives roles for each staff person, making sure that each person has the information they need to successfully implement these programs. Another key component of successful BCN and Wise Woman programs is that you need to have intimate knowledge of your electronic health record system for a couple of reasons. You can document screenings, which you will receive credit for quality improvement measures, but you can also use your electronic health record system to activate annual screening campaign. So we don't just want this to be a one-time thing for offering BCN and Wise Woman services. You want those women coming back year after year for services, and you can automate that process through your EHR system. And then really at the end of the day, most programs that are successful really create a seamless integration of BCN and Wise Woman when that patient registers for their first appointment. The front desk staff is knowledgeable. Like when they do the financial screening, they know, hey, you qualify for Best Chance Network and Wise Woman services, and they qualify them, they secure those pre-authorization codes, and they bring the woman in for services, and ideally services that could be offered on the same day. So these are just some of the lessons learned that we've discovered from successful programs. So those three major building blocks. So as Genevieve said, if you are currently a BCN provider, you can add on Wise Woman with the new 5-year contracts that DHEC is disseminating. You can actually add on Wise Woman without having to do separate paperwork. Most importantly, you receive training, but also it's very important to establish and maintain relationships with DHEC staff. You should have Trinessa's number on speed dial, Linda's number on speed dial, Genevieve's, in terms of really having someone to connect with as questions come up for your program. This particular suggestion, the last one, is for smaller practices in rural communities that have limited numbers of staff, because often it really takes one dedicated person to do this work. Really consider using interns and having BCN and WISEWOMAN be their internship opportunity and develop a relationship with your local technical college. So you have a system of rotating interns, and this provides a wonderful hands-on learning experience dealing with a vulnerable population, but also learning about the EHR, working with staff, team-based care. So for those of you that are on the fence because of staffing issues, really consider building linkages with a local educational institution to provide support. Reminder, this, Ms. Genevieve emphasized this, submit all claims 30 days from the date of service. Do not hold claims, and because they're closing out the grant year, you have until June 19th to submit all outstanding claims. So, and that's not just for BCN, that's for WISEWOMAN as well. And now we are at the question and answer session. So you have two options. You can raise your hand, and I'll look for your hand to be raised. On the panel, you'll just click on that hand and I'll unmute you and you can ask your question, or you can type your question into the chat box. So at this time, I'm going to go to the control panel and see if anyone has any questions. Okay, so far, no. We'll check one more time. So going once, going twice. Okay, so this is not the, oh, we actually have a question that did pop up. Hold on just a minute. Describe the steps needed to verify the 200% or 250% level for federal poverty. So Linda, that might be a question for you. What are the steps needed to verify that a person actually falls below 200 or 250% below federal poverty?
In the Best Chance Network Provider Manual, I believe there's the BCN income guidelines, and it will list household income based on family size, and that's just a quick way to determine what the federal poverty level is for that. Plus Medit, I believe, calculates that. I don't use Medit very much. Genevieve, are you still on the line?
Yes.
Does Medit automatically calculate a federal poverty level?
Yes, once the provider, if a provider sends in the information, the income of a patient, and we enter that into the system, it will tell us whether or not a patient qualifies or not. If they're within the guidelines, they will be approved for a authorization code. If they're not, then it will say, you know, they can't receive services.
And then the follow-up question, this is from Shannon Chambers, and she is a director with South Carolina Office of Rural Health. She also presented a question, do they have certain verification that they have to submit? So there's income guidelines, but Linda, typically, what are the type of things that healthcare providers are looking for to verify income?
I'm not really sure about that. I think different centers have different criteria, but I would imagine they would have to bring in some kind of bill stub or
right.
You have an income. I'm not the best person to speak to that. Maybe there's somebody else who could put in the chat box answer of what they do to verify income if they're a current BCN provider. I don't want to misspeak or misrepresent anything.
Yes. So if you are, if you represent a federally qualified health center or a rural health clinic, and this will probably be a part of the financial eligibility screening process. If you have examples of the type of things that patients need to verify income, please type that into the chat box and send it to the entire audience. But at a minimum, usually it is a pay stub. If they are unemployed, Some centers require a letter just to verify that in terms of incomes, but each center is different. But good question, though. So if there are no more questions, I'd like to just invite you to join us next week for our final webinar in this training series. And the next one will be focusing on annual screening events. So there are usually two ways that patients can be engaged in the process. It's the individual clinic, where you have information in your lobby, you have front desk staff that alert a woman that she's eligible for services. But another wonderful strategy is having community-wide screening events. So next week we'll have Denitra Bovian from Singleton Health Center in Orangeburg, and they also have a site in Santee, and they've actually done strategy community-wide screenings. I am tongue-tied today, y'all. I'm sorry. So they are going to be sharing just the steps that they take to have a community screening event. And also I'll be sharing some resources that you can use. So that might be a good starting point for you, is to connect with other community-based agencies and have a screening day. But most importantly, connecting that patient to a medical home once those screenings are over for follow-up care. So we'll be going over the steps you need to take to have a great screening event. So join us Thursday of next week from 12 to 1. And then that closes out our online training series. And then we will be preparing on Monday, June 26th, a health coaching boot camp. And so this is really for folks that are thinking about becoming Wise Woman providers, where rural providers can send staff, whether they're medical assistants or CNAs or certified medical assistants, or even nurses, to come to this training and learn the basics of health coaching, which is a core component of the Wise Woman model. But as we look at the merit-based payment incentive system, this will be one of a long list of quality improvement activities that you can receive credit for. So having an embedded health coach in your practice for Wise Woman also presents other benefits to be reimbursed by other payers. So that is Monday, June 26th at the Wingate by the Wyndham Hotel in Lexington, South Carolina. At this point, at last check as of Tuesday, the count was at 32, and we planned for 50 participants. So I really strongly encourage you, if you are thinking about becoming a Wise Woman provider, is to really contact Linda immediately and designate a person to send to the training. We will have Dr. Cheryl Dye, who is a state leading expert in peer-based health coaching, particularly around hypertension. So she's going to be talking about the process that she used to train community lay people to become health coaches, and really demystify what that is. And then we'll have small group activities, role play. So not only will you receive the information, but you will go back to your respective healthcare facilities with practical skills to activate your programs. In the second half of the day, we actually have speakers that are actually Wise Woman providers. They will present different models of care, whether you want to take advantage of a mobile opportunity. Rural FQHC site will be presenting, and then we actually have a Wise Woman health coach who will talk about her process in terms of how she engages patients across one or more health coaching sessions, but she'll also be giving some tips for serving the Latina community. So wonderful program we have in store for you, so do not wait. If you look in your chat box, the link has been provided to register for the training. This training is free, and this health coaching boot camp has been sponsored by the Best Chance Network and Wise Woman programs that are administered by the South Carolina Department of Health and Environmental Control. And the funding is coming directly from CDC. So this is a wonderful opportunity to receive hands-on training and walk away with some really great skills. I'm going to check the question box one more time. Oh boy, we have another one. This is from Deisha Adams, and she is a staff person with the team over in the cancer division at DHEC. She said, Tiffany, providers must keep a record showing how much the patient makes. It must be verified annually. They can use pay stubs, signed statements, or tax forms. So boom, that is the answer to the question. So I know most federally qualified health centers already have a formal process, but if you fall outside of the FQHC umbrella, you can use pay stubs, signed statements verifying income, and past tax returns. And we have a raised hand. Let's see. This is Fredlicia Porterfield. You are live, Miss Porterfield. What is your question?
Okay, who I was hearing, and you were saying someone was a health coach. Who are the health coaches?
Okay, so health coaches are a designated staff person within a practice. And so when you sign up to become a Wise Woman provider, a requirement is that you designate a health coach, and they are sent through formalized training. So there's the training for Wise Woman, but this health coaching boot camp is to really provide an overview, and you can also sign up to become a provider at the boot camp. So this is a live training, and then Yes. So, and actually there are Wise Woman health coaches that will be attending this event, because one of the things that we really wanted to emphasize is coaches helping new sites develop strategy around implementing the program. Did I answer your question?
You did.
Linda, do you have anything to add to that?
No, I think you summed it up pretty well. Currently, if you are a WISEWOMAN provider, we do again ask that you designate at least one person to serve as that WISEWOMAN health coach. If you have more than one site within your healthcare system, it would be beneficial to have more than one coach so he or she doesn't have to travel very much. And it could be anybody with clinical skills, such as a nurse, a medical assistant, LPN,
Okay.
dietitian, health educator, diabetes educator, pharmacist. Yeah, as far as the WISEWOMAN program, it's we're not going to tell you necessarily who to pick, but we are looking for someone who is good with patients, good at motivating women to make changes, someone who does have enough time to devote, because the WISEWOMAN health coaching does involve time spent with the woman in person as well as on the phone, with follow-up phone calls. So it can be difficult if it's a nurse who's tied to a provider and has to do patient exams all day. So, just consider who in your facility might be that one or two people who would really enjoy doing coaching and is really good with interacting with patients.
Okay, gotcha. Thank you so much.
Okay, and Fredlicia, we actually had a session on health coaching last week. I don't know if you were able to participate, but I can also send you the link to that. And at the end of that,
That would be awesome, because
so I'll send that to you after this session is over. So yes, thanks so much for asking that question, and we'll provide that resource for you, and hopefully we'll see you at the boot camp on the 26th.
Oh, you absolutely will. Okay.
Take care. Let's see if we have any more questions. Let's see. Lisa Melendez, buenas tardes. How are you? Lisa, are you there? Lisa, for some reason, I unmuted you and I can't hear you. So if you can type your question in the chat box, that would be great, so we can capture your question. Lisa, are you there? Lisa. There we go. Lisa, if you had a question or if you wanted to clarify anything around health coaching, please type that into the chat box. From Jolanda or Yolanda, please forgive me if I mispronounced your name. Is the presentation available? Yes, indeed it is. It takes about a couple of hours for it to be recorded, and then we upload it to the GoToWebinar website, and you will receive a follow-up email when that recording is ready. I think we have another question. And I think Lisa has typed in her question. Okay, so this is a question, I believe this is around fasting. So this is a Linda question. I have patients who come in and they ate breakfast or drank juice that morning. Does that disqualify them for a Wise Woman visit?
No, because they can get the total cholesterol, the HDL cholesterol, and the hemoglobin A1C non-fasting. The only test that would absolutely require fasting status is a lipid panel and a blood glucose. So no, if she ate something, she can still get the basic labs. It's the HDL cholesterol, total cholesterol, hemoglobin A1C. Not a lipid and not a blood glucose.
Would they have to come in, would they have to come back in for that test, Linda?
It just depends on the setup of the health facility. Some do prior to the appointment. They'll send all their patients to a lab, and then the lab reports are ready when they have that exam. Most will draw the blood the same day as the BCN WISEWOMAN exam, and then some woman could come back later within 30 days if she absolutely had to, but it's kind of hard for folks to come back in, so it would be good if you could get all of that lab work done either ahead of time or the day of the appointment. So the policy is 30 days plus or minus a screening visit. So within that window, those are acceptable time frames for getting her lab work done. If the screening lab result, if there's an abnormal screening result, for instance, her A1C is high, you can bring her back in fasting and do an oral glucose tolerance test, or if her total cholesterol is elevated at her screening visit, have her come back within a few days fasting and do a lipid panel so that you can verify a diagnosis or not.
Okay, and that does have to happen within that 30-day window, correct, Linda?
Yes, ma'am.
Okay, so we are right at 1:01 p.m. So in the interest of time, I want to go ahead and just emphasize that the South Carolina Office of Rural Health also provides technical assistance for BCN and WISEWOMAN. We are partnered with the BCN and WISEWOMAN programs, but we also can provide support if you're interested in becoming a patient-centered medical home. We have quality improvement coaches that can be deployed to your facility to provide technical assistance and do a workflow analysis and give you spot-on feedback for improvement in terms of moving patients through your clinical process. Also, we have macro technical assistance. So again, those of you that are preparing for the merit incentive payment system, we also have technical assistance related to that. Shannon Chambers was on the line today, and she is directly responsible for interfacing with rural health clinics. Those who are interested in receiving a rural health clinic designation, which provides a higher reimbursement for services that are provided, and we have in-house staff that can provide coding and billing advice for those RHCs. So those are other opportunities that are available to you. Here is the key contact information for Genevieve Gamble around billing for WISEWOMAN. For those of you that are interested in signing up for the BCN program, this is Dr. Trinessa Jones' information, as well as Linda Peckery. My name is Tiffany Simpson-Crumpley, and I'm the Education and Training Consultant and responsible for bringing you these trainings through our partnership on a weekly basis. LaShonda Pettaway Brown is a quality improvement coach who works intimately with practices to help them. So if you are a provider and struggling, definitely reach out to LaShonda. I'd like to thank you for joining me today. The PowerPoint as well as the recorded sessions will be available within the next 24 hours and can be sent out to you, and so you'll receive an email. Please complete the 4-question survey that will pop up immediately following this session. With that said, thanks so much for lending your lunchtime today, and I look forward to seeing you next week. Take care.